weeks, doctors and nurses and hospital systems have been sounding the alarm that they will be running out of personal protective equipment. In short, they call them PPEs, of course, an acronym. But we're talking about masks, gowns, gloves, everything they need to protect themselves as minimum in order to protect you while treating coronavirus patients. Remember yesterday we told you about a Georgia hospital system saying that it had ripped through 5 months of protective gear in just 6 days, and they're trying to sound the alarm. Joining me right now is the president and CEO, Scott Steiner of Phoebe Putney Public Health System in Southwest Georgia. Thank you so much for coming in.
Thank you for having me.
So can you first, Scott, help people understand why your teams had to go through 5 months of supplies in 6 days?
Yeah, it really started last Tuesday. We've been standing up our command center for quite some time, waiting for this. We've waiting for the coronavirus to hit the United States. We've been overbuying supplies, but until it truly does, you don't quite realize what you're going to be going through. We began to see our influx of patients last Tuesday and last Wednesday. And we didn't. What we know today is to your point, we have gone through 5 months, now 6 months worth of supplies in less than a week, and we are scrambling. We're scrambling, and even to the point where these are N95 masks. We've got 3 days of supply of N95 masks on hand. In order to preserve these and get them to last longer, we've got a team of people sewing masks together. This is surgical sheeting. And this is our prototype. We've got about 3,000 of these made. We believe we can make 200,000 of them. It will take a few weeks, but this is the kind of what we're having to do because we don't know when that next shipment is coming.
Wait,
we're trying
Scott,
to source.
I don't want to interrupt, but that is amazing, the lengths that you're having to go to now. I saw this actually mentioned in a press release. You have employees sitting in conference rooms now, as you could show folks that one more time because there was a graphic in front of it, now putting together alternative masks in order to explain it to folks so you don't have to throw out an N95. You could kind of extend the life of an N95 mask.
An N95 is a filtered mask. This keeps our staff safe, and we want our patients safe and our staff safe. This can be worn for an extended period of time, but if it becomes soiled, if we believe there are droplets on it, it should be discarded. Normally, it is a discardable item after each use. But we believe by being able to cover it with these masks made of surgical sheeting, we can extend the life of these. So instead of going through 8 or 9 or 10 a day, maybe an employee can only go through 2 or 3. Because again, we're running short, and we're concerned about running out. And if we can't keep our employees safe, there'll be no one to care for the patients.
And that's exactly right. And I will say, this is personal for everybody, but this is personal for me. I have 2 doctors in my family. One of them, my father, who's 70 years old. If they do not have this protective gear, can they be safe?
They cannot be safe. If you've got a patient that is positive for COVID-19, they are highly contagious. Our employees would not be safe without this PPE. I mean, it is critical.
Where are the supplies? You've said that you've been buying them up. What is the other than having to? Unbelievably, in the United States of America, you have folks in your hospital now trying to sew masks together for your healthcare providers. What is the other option? What is your ask of the state? What is your ask of folks in Washington who are seeing this and maybe now can get their hands around and grasp what a dire situation you're actually up against?
That's right. Every hospital is looking at how many days on hand do you have of masks, gowns, gloves, eye protection. We have bought eye protection off the shelves of local stores. We have reached out. We've got an incredibly supportive community. And I would tell you our political or our governmental leaders, I know they're all supportive. They really want to do the right thing. But I can tell you we were just looking at sourcing these out of a company out of Mexico. And they want $7 per mask. They've got 1 million of them in hand. And this is a mask that normally would cost us 58 cents. But I would tell you, we're probably going to go ahead and take them for $7 each because we're that desperate.
Wow. You have also been sounding the alarm on another aspect of this crisis, the still lack of test availability and how long it's also taking to get test results back. What are you hearing about what the holdup is still?
We're not hearing really much. We've been using a large commercial lab. I would imagine they're inundated. There's probably not much more to it than just a volume and a supply and demand aspect to it. But we've got as of this morning, we've got 9 positive patients, 21 negative patients, but 400 that were pending. Some of them greater than 6 days. We're waiting on results.
Did you say 400?
400 pending, and we're probably testing more than 100 each day.
Scott.
Now those are not in the hospital. Let me just clarify that. About 75 are in the hospital. Most of them are at home, but we've got to get these results for peace of mind for people, for our peace of mind of our healthcare workers and our doctors. But that's our big push: is we need more testing, and it just the quickness of it. That just has to improve.
Time is of the essence on all fronts that we're discussing right here. Getting protective gear for healthcare providers and also getting these test results back so folks know what they're up against. Scott, thank you so much for coming in. Thank you for what you're doing. Amazing innovation that you already are doing amongst your staff. I hope a lot of hospital systems are seeing what you're doing and looking to do it themselves in order to save the resources that they have. Thank you.
Thanks for getting the word out.
Thank you so much.